Hello, I'm Tony DeMaria, the editor of JACC, here with Inside JACC, and today I'm going to discuss the April 10th issue of JACC, which is an interventionalist delight. We have a number of trials that have come from the recent TCT meeting, as well as other studies relating to interventional cardiology. And the first study comes from the 20 trial, and that was a randomized controlled trial between two second-generation drug-eluting stents, the zodorolimus-eluting Resolute stent and the everolimus-eluting Xience stent. And these are two very good second-generation stents. They were compared in a randomized controlled trial. And the primary endpoint, which has become a relatively primary endpoint standard for many of these studies, was target vessel failure, which typically reflects a composite endpoint of death, myocardial infarction related to that vessel, or the need for revascularization, the occurrence of restenosis. And target vessel failure was found in about 8% for both of these stents, about equal. The second study was the EVOLVE study, and the EVOLVE study went a step further and tested a stent that had a bioabsorbable polymer in an attempt to try to reduce inflammation and decrease restenosis. And the results of EVOLVE, which tested the everolimus-eluting stents, one with a absorbable polymer and one without, was that they were about equivalent. Now, the last study was the ampholis-eluting stent, and this takes it one step further. That is to say, not only was there not a bioresorbable eluting polymer, there was no polymer in this ampholis-eluting stent. And in fact, again, as compared with a stent with a drug-eluting polymer, the results were equivalent. So it does appear that we are marching forward in terms of stent design with these new trials to get better and better stents that hopefully will have a better long-term clinical outcome, less stent restenosis. Now, the last study I'd like to tell you about is the PEPCAD-DES study, and this study tested a paclitaxel-coated balloon as opposed to plain old balloon angioplasty for the treatment of in-stent restenosis. You might argue that balloon angioplasty isn't an appropriate comparator, but nevertheless that was used for this study. They looked really only at 6-month late lumen loss, and the paclitaxel-coated balloon clearly was superior. So again, I think we see with all these studies that we are progressively improving our stent design and our technology for interventional cardiology, hopefully to produce better clinical results and less late stent thrombosis. For Inside JACC, I'm Tony DeMaria.